Good morning to everyone on the call. As Tom introduced, my name is Jackie Mulgrew. I am a physical therapist, and I've been practicing now for 30 years. So I hope that what my goal today is to bring all of my years of experience with all the questions that I've been asked, the questions I've researched, the information that my students have asked me, my staff have asked me, and put it together in this presentation that will help you understand the physical therapy management of patients with heart failure. As you get to know me a little bit, I'm going to ask that I get to know you a little bit. So there will be some questions here that I would like you to answer. I'm just doing it forward this. There we go. So there'll be some survey questions for you. And as you do that, I'll give you a little bit more background on myself. So as I mentioned, I've been practicing for about 30 years. Most of my career has been in acute care. And I am now, for the last nearly 20 years, a board certified in cardiovascular and pulmonary care. So I am a specialist in that area. I've also got the privilege of being able to author a book chapter on mechanical circulatory support, and I've published some other research in vascular care. And my clinical interests have really been around exercise physiology, heart failure, and mechanical circulatory support. I teach in a acute care hospital in Boston, and I've been working there for most of my career. And I've also had the privilege of teaching at some of our local colleges. I would say most of when I was younger in my career, I would get a little bit nervous about asking questions and thought I had to know all the answers coming out of school. And I soon got rid of that theory and started to listen to my students and my staff and say, okay, what is it that you don't understand, and why is it that you're stuck? And what is it I can do to help you? And so I started writing down all of the research and the questions and the answers and put them all together. And I've now, as I said, put this into this presentation for you. So it'll be, I'm just going to take a second here just to look to see who I have on the call. Obviously, the majority of you are PTs and PTA, but I do like to see that some of you are in a nice spectrum of home health, rehab, outpatient, acute care. And even though my career has been spent in acute care, I've also certainly worked in a major hospital with our ambulatory staff, and I've done some rehab work. So I would expect that this presentation is going to help you, no matter what setting you're in. It's going to help you manage patients with heart failure. And certainly here, a nice spectrum of years of experience that you all have had. All right, so with that, let's move forward, and we'll get into the presentation itself. So my objectives today is for you to understand the pathophysiology of heart failure. I think if you understand that, then it's going to make a lot more sense to what you see and how your patients present to you. And then we'll talk about how the exercise implications. What are the exercise implications for current medical and surgical interventions in heart failure? I want to make sure you understand the clinical decision making involved in our PT exam. So what is it that we do that helps us understand the patient's impairments related to heart failure? And then we'll look at the evidence that is out there currently on the exercise prescriptions that we should be prescribing to patients with heart failure throughout the stages of their disease. And then lastly, I want to make sure you recognize indications for terminating exercise when you are working with patients. So we have about at least the prevalence of heart failure is about 5 million in the US.